How'd you like to work 3 days a week and make $92,000 a year?
Sounds like a great gig, doesn't it? And guess what? It's a state job, and you're paying for it.
Tonight, Fox Undercover's Mike Bodette investigates.
In these tough economic times, at least $500 million could be cut out of the state budget, and it's likely going to affect you or someone you know. Everything and anything could face the budget axe, from funding to help needy kids to health insurance for struggling senior citizens. But as our elected officials cut, are they really trimming all the fat? We found a job at the Statehouse that's been around for half a century. Vermont doesn't have one, New Hampshire doesn't have one, Rhode Island doesn't have one, and Connecticut doesn't have one either. So why do we need this job here in Massachusetts? It's a golden opportunity with job security. The position is mandated by state law.
I know where the office is.
It pays the kind of money most state workers only dream about, $92 grand a year.
It would be nice.
All that for only a few days of work a week. Never seen him.
Never seen him.
Well, meet Dr. Raymond Gibbs, the Statehouse physician, 81 years old and still working. The former surgeon started caring for patients at the Statehouse in 1986.
This position is silly.
Barbara Anderson runs Citizen
Aspirin. They can put their own Band-Aid on their little fingers.
Fighting fevers to first aid. It's all part of the job for Dr. Gibbs. That is, if you can find him here. We discovered the doctor is not in very often. We watched the doctor on 3 days. On a Tuesday, he got to work at 9:30 in the morning. Less than 3 hours later, he was already back in his car. He wasn't going out to lunch, he was heading home. On the job, 3 hours. On a Wednesday, the doctor arrived at the Statehouse just before 9. Just before noon, he was out the door, going home. On the job, 3 hours. And on a Friday, Dr. Gibbs never went to work at all. On the job, not today. He's got Fridays off, and Mondays too. We just wanted to ask you a couple of questions about your job.
Not now, I'm busy.
We called Dr. Gibbs for an interview, but he said he couldn't talk to us. Can you just tell us a little bit about why the Statehouse needs a doctor?
No comment.
The Executive Office for Administration and Finance tells Fox Undercover the Statehouse doctor works 3 days a week and is on call for lawmakers during late-night sessions. Dr. Gibbs is in charge of 3 nurses who work at the Statehouse in the McCormick building next door. They treat employees and visitors for free, but you're really paying for it. Taxpayers shell out $250,000 a year for salaries and supplies. These records obtained by Fox Undercover show the doctor and his staff treated around 4,500 patients last year. 101 injuries and 44 people went to the hospital. We've also learned that Statehouse retirees are still coming here for free care.
The last thing they need at the Statehouse is their own doctor, whether or not he's competent or good at what he does.
If there's an emergency, Mass General Hospital is just a mile away. And state employees have insurance so they can go to their own doctors.
The doctor is just a symbol of their specialness, and that's the thing that I think we have to get rid of.
So how serious is Acting Governor Jane Swift about getting rid of waste in state government?
Our economy is in a very perilous state.
Governor, you're trying to cut costs. Do we really need a Statehouse doctor? Is there a better use for the money? When we asked, she didn't want to talk about it, but the next day she made her Secretary of Administration and Finance available. Is this position necessary?
I would think in the big picture of things, this is something that the governor, in fact, I know this is something that the governor's going to want to take a real hard look at.
The executive director of the Human Services Coalition says there are better uses for the money.
In these days of fiscal crisis, I would much rather see $92,000 going to keep elders enrolled in our senior pharmacy prescription advantage program.
Money for a prescription program or a Statehouse perk. After we brought this to the state's attention, the doctor's timesheets were checked. According to a spokesperson for Administration and Finance, Dr. Gibbs claimed he worked 9 to 5 on the days we watched him leave the office after only 3 hours. Now the Executive Office for Administration and Finance is conducting its own investigation. So what do you think? Does Massachusetts need this position? Right now, budget negotiations are underway. If you want to weigh in on this issue, call the governor's office. Here's the number, 617-727-3600. And if you have a story you want Fox Undercover to investigate, we want to hear from you. Call us at 1-800-TV-FOX25. I'm Mike Bodette for Fox Undercover.